Well, I can help you with cuts and bruises, but the other stuff you're gonna have to see a real doctor.
Hey, smartass, we can't afford it.
Hey, smartass, yes you can. You have insurance.
Neither of your asses are that smart because insurance is for if something bad happens to your car. P.S. I haven't had it in years.
Like Andy and April, the majority of Americans get their health insurance through their employer. In fact, Obamacare requires that employers with over 200 employees offer health insurance. The main reason to mandate employer-based coverage is to ensure that everyone is insured, not just the healthy or low risk. In the past, if you had diabetes or some other pre-existing medical condition, you could be turned down for insurance or your cost for coverage would be astronomical. Now, you can't be turned down for any reason. Obamacare also offers customers discounts, known as tax credits, on government-sponsored health insurance plans and expands the Medicaid assistance program to include more people who don't have it in their budgets to pay for healthcare. That way, Andy and April can afford the healthcare they need.
However, health insurance plans can be confusing, so it's important to understand how it works and what it covers to avoid surprises. There are many different types of public and private health insurance plans to choose from, all with different costs and benefits. The two main types of public health insurance, or managed care plans, are HMOs and PPOs. The focus of managed care plans like HMOs and PPOs is to provide preventative care. So, what is an HMO? An HMO is the broadest type of health care coverage available. It fully covers the cost of physicals with less out-of-pocket costs during the plan year. The deductible, or the specified amount of money that the insured must pay before an insurance company will pay a claim, is often $0. Usually, the higher the deductible, the lower the premium. And an HMO normally has a copay or a small fixed per visit payment for most services. However, HMOs offer primarily less choice in doctors and hospitals. Sometimes the hospitals in an HMO or the doctors will be employees of the HMO and not in private practices.
In contrast, a PPO almost always has a deductible and coinsurance. If you stay within a network, there are also copays for certain services where the deductible and coinsurance do not come into play. For example, an office visit might be a $15 to $40 copay without regard to a deductible for coinsurance. For a hospital stay, you would be responsible for the deductible and your portion of the coinsurance. There is always an indemnity plan included in the PPO, which allows you to see any doctor you wish. However, the out-of-pocket charge to you will be greater. In terms of what you get for these charges, PPOs provide a great deal of choice of doctors and hospitals. Because of this, the PPOs are the most popular plans at this time. However, coverage is not as comprehensive as the HMO, and you would experience greater out-of-pocket expenses.
If you're reasonably healthy, have no need to see a specialty out-of-network doctor, and want to pay less, consider an HMO. Or if you're willing to pay extra for specialty care, for example, if you have skin problems and want to see a dermatologist, consider a PPO for the ability to see an out-of-network doctor. And whatever you choose, keep in mind that there are limitations to American healthcare. These include pre-existing conditions, cosmetic surgery, non-traditional treatments, home care, and mental health treatments.
Not every country has this system though, and many countries have features to their health coverage that the United States doesn't. For example, New Zealand has a single-payer system. This is like Medicare for all. It's a system in which the residents pay the state via taxes to cover healthcare costs, rather than individuals buying from private insurers competing for their business. New Zealand is also different because for injuries resulting from an accident, treatment is free, even for tourists. That covers any accident, not just road crashes, and even if the person who was injured caused the accident. When my mom was in a minor car accident during our last visit, we were able to get her treatment without worrying about eligibility or payment. Hospital and specialist care in New Zealand is also totally covered by the government if the patient is referred by a general or family practitioner, and this is funded from the government expenditure.
We have to repeal and replace Obamacare. You take a look at the kind of numbers that will cost us in the year 17. It is a disaster if we don't repeal and replace. Now, it's probably going to die of its own weight, but Obamacare has to go.
So where is American health insurance going now? Honestly, we don't know. The ACA is highly controversial. The new Trump administration wants to repeal and replace the ACA, and on March 6th, Trump and congressional Republicans tried to repeal Obamacare with the American Health Care Act, but they did not achieve the votes required and pulled it on March 24th. The plan would have replaced ACA's tax credits, penalties on non-buyers, and eliminate taxes on individuals with high income. But Trump still says Obamacare will explode and we will all get together and piece together a great health plan for the people. Do not worry. Recently, President Trump also threatened not to pay $7 billion to insurers in annual subsidies to give discounted coverage to low-income Americans. Trump said Obamacare is dead next month if it doesn't get that money. If nothing changes, premiums for all of us would have to increase by about 20% in 2018 to make up for the subsidy loss. We'll just have to stay tuned and see what happens.
Hopefully this video gave you an idea of what health insurance is like now, what it's like elsewhere, and where it could be headed. Health insurance is complicated, but with some research and patience, you can definitely understand the fundamentals.